National Nutrition Natural Health Reviews. 3 minutes of the latest naturopathic info with Canada's leading nutrition experts. Watch, learn, and get healthy naturally.
Hi, I'm Dr. Jonathan Beatty, naturopathic doctor and a health expert here at nationalnutrition.ca. I want to talk to you a little bit today about hearing and things we can do to help ensure that we have adequate hearing health throughout our life. Now, there's 2 types of hearing loss that one might experience. One is called conductive hearing loss, one's called sensory neural hearing loss. Basically, there's 2 major ways or 2 major things that are involved in hearing. One is the actual passage of air into the ear to bump against what we call the eardrum or the tympanic membrane. Now, if you have a blockage in your ear, say, I'll gross you out a little bit, a bug has crawled in your ear and died, and it's preventing air from getting to your eardrum, you're not going to be able to hear very well out of that ear. A more common thing is that you actually have a buildup of cerumen or earwax in your ear. That's blocking the air from getting to the eardrum properly, and that's going to lead to some conductive hearing loss. So if you have any hearing loss or you suspect you do, you can go to your doctor, they can test you, and they can do some fancy tests with tuning forks that will help tell you whether you have conductive or what we call sensory neural hearing loss. So for conductive hearing loss, it's usually a mechanical hearing loss, and there's usually therapies that your doctor can perform to remove the blockages, or you may require surgery if there's been damage to the eardrum or there's some other reason for the blockage. Now, more common is sensory neural hearing loss, and that's typically due to damage to the auditory nerve, and often that comes from either a lack of blood flow or damage due to some sort of infection. So the 2 ways you're typically going to look at addressing that sensory neural hearing loss is you're going to try and support the body to prevent against recurrent infection, as well as you're going to try and support the health of the auditory nerve. So in order to prevent infection, well, if you do get an infection, there's a variety of different ways you can treat it depending on the type. Typically some sort of antibiotic therapy, be it herbal or pharmaceutical, is going to be helpful. But then you want to actually make sure that you re-inoculate yourself with the proper bacteria to prevent any type of recurrence of that infection. In fact, studies have shown children that receive antibiotics for an ear infection immediately upon diagnosis are actually at an increased risk of recurrent infections than if you delay the antibiotic use. So, oftentimes we see this recurrent infection happening in people, and one of the things you can do to prevent that is use probiotics. Now, most probiotics on the market are designed for the intestine, and obviously the bacteria that lives in your intestine is going to be different than that lives in your ear and in what we call your oropharynx. So in order to support that bacteria, look for something that contains Streptococcus salivarius, and that's the type of bacteria that actually fights off Streptococcus pyogenes, which is what causes most ear infections. So what you're doing is inoculating yourself with the arch nemesis to the pathological bacteria, and that's a great preventive tool that you can use to limit your risk of ear infection. Now, in supporting the auditory nerve, one of the things you're going to want to do is focus on improving blood flow. And one of the easiest things that you can do for that to improve your blood flow is you can look at taking lots of different antioxidants that support the health of your circulatory system. So some things you might want to consider, ginkgo biloba can be very effective for this. It can be very helpful for managing any type of hearing loss. As well too, you can look at things like vitamin E. Vitamin E is very important for your cardiovascular health, and it's a great fat-soluble antioxidant, and that can actually be very beneficial. So if you do suffer from hearing loss, get checked out, make sure you get a diagnosis as to what's creating the hearing loss, and then look at some of the things that you can do to support your hearing loss and hopefully improve your hearing down the road. So if you like this video, subscribe to our channel to check out more of them. Any questions or comments can be posted below, and always remember, knowledge is health.